The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show. Hello, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. The big medical news recently is that our friends at the ACIP have formally recommended changing the CDC guidance on giving the hepatitis B vaccine to all infants at birth. They're now recommending shared decision-making with mothers, with the implication being that mothers who do not have hepatitis B don't need to vaccinate their children immediately. They're recommending that those babies not receive the Hep B vaccine until they're at least 2 months of age. I thought I'd just do a whole episode about this and the hepatitis B vaccines. I talked about hepatitis B in a recent episode, but I want to just go over this whole situation and make it a whole episode. First, a couple other things. I've been meaning to direct everybody toward the Not Otherwise Specified podcast, which is put out by the New England Journal of Medicine. They've been doing a series for the past several weeks on primary care and basically what's wrong with primary care, problems affecting primary care. And it's been very, very well done. It's very good. I like the host, other than how often they keep saying how terrible it would be if advanced practice providers were the only primary care people. It's a really good series, so check that out, Not Otherwise Specified. I listen to it on Spotify. I assume you can get it everywhere else you can find podcasts. Also, one of the recent episodes of the Curbsiders was really good. I want to recommend that specifically. It's number 506. It's one of their digest or hotcakes episodes where they review specific articles. They kind of go around the room and they have some really smart people who talk about appraising articles, and they just go through each one kind of with a fine-tooth comb and talk about whether or not it's practice changing, whether or not they think it's valid, etc. This particular one kind of meshes with what we're talking about today. They dive in a little bit to some of the controversial things that have come up in popular media lately. They talk about prostate cancer screening, acetaminophen and autism, COVID-19 vaccines and cancer. And then the last topic actually is aspirin and anticoagulation together in coronary artery disease, which is apparently now called chronic coronary syndrome, I learned. It's a little bit different for them, but I found it really useful and helpful, so check that one out if you haven't heard it already. Another thing I wanted to talk about, today when I was at the gym, I saw a commercial on CNN playing on one of the TVs there for a documentary on the Scientology network that is actually airing tonight, I guess. I'm recording this on Tuesday, December 9th. So it will have already aired by the time my episode comes out. This documentary is called Prescription for Violence: Psychiatry's Deadly Side Effects. And it looks like the whole premise is that psychiatric medications are causing people to commit mass shootings. So that's just what we need, is for all the potential mass shooters to stop taking their psychiatric medications. I'm sure that will help. The problem, y'all, I feel like medicine, like real medicine, legitimate medicine, is under attack in a way that I've never felt in my career. It could just be my perspective, but more and more, it just feels like there's pushback and questioning and people not believing in actual science and actual medicine, which is disturbing to me. I think we're going to see a backlash from all this. And I think this in itself, I guess, is a backlash to everything that happened during the pandemic. I want to do a deep dive on that someday and try to figure out why it is that people got so mad and why people think Dr. Fauci is evil and all this stuff that you hear going around. I've never really understood all that. If I had to guess, I would guess it just stemmed from how much uncertainty there was during the pandemic, particularly in the early days, about what it was and what we should do. And I remember being frustrated by the guidance changing because I never knew from one day to the next what I should tell my patients. You know, do you wear a mask? Do you not? Do you isolate? Do you not? What do you do if you get sick? It was a very frustrating time, and it was deadly serious, right? People were dying from COVID. Lots of people. I bet none of us will ever forget the images of the refrigerated trailers parked outside the hospitals in the big cities to hold all the dead bodies. So it was a serious thing, and really nobody knew the answers. From my point of view, I saw that as the scientific process, the medical institutions just working their way through it and trying to figure it out like everybody else. And of course, the guidance changed as they got new information and looked at new data, et cetera, which I see as just a normal part of scientific study, scientific investigation, but obviously not everybody perceived it that way. And I think another element to it is just that people don't like being told what to do. The idea that people felt the government was forcing them to stay home and forcing them to keep their kids out of school and forcing them to wear masks and forcing them to get vaccines. I think that just pissed a lot of people off. And I can understand that too. There's a whole cohort of kids who are clearly behind because they did not learn what they would have otherwise learned if they had been in school during COVID. At least that's what my teacher spouse and different teachers that I talk to tell me. And if you are somebody who couldn't work during the pandemic, who got sent home without pay, obviously that is devastating. So I get being mad about that. There was a moment when the government literally tried to force federal workers to get the COVID vaccine. I would have said I was for that right up until the minute it actually happened. And then it weirded me out. I was definitely in the camp of, oh my God, why are these people not following the recommendations? Why are they not putting masks on? Why are they not staying home? Why are they not getting the vaccines? I would have said, yeah, we should force people to do all this stuff. But when it came right down to it, when they actually said federal employees must get the vaccine or you're fired, that was too far. I was like, no, we shouldn't force people to do things that they don't want to do. That's just counter to our values as the American medical system, I think. So I was not for that. And I actually did what I could to help some individual patients try to get exemptions from that just because I don't like that. I don't think that's right. But outside of that, at least in my area of the country, I would say most people were not really forced to do anything. We definitely still saw people going around doing whatever the hell they wanted, seemingly without any regard for the pandemic or anybody else's health or their own health. So I don't know that it was really as oppressive as people make it out to be. That could be different in other parts of the country. I did go to Chicago maybe in 22, closer to the beginning of the pandemic. And up there, to go to a concert or to get into a restaurant, you had to show your COVID vaccine card. Like, they were not kidding about all that. And you had to wear a mask. So in other parts of the country, I would assume more liberal parts of the country, maybe it was a little more restrictive. But here where I live in Alabama, other than the kids staying home, I don't know that most people really were forced to do much of anything. But anyway, I think what we're seeing now, all this pushback or this loss of faith in science and medicine, is probably the pendulum swinging back the other way, is probably a backlash to all that. Time will tell, I suppose. But it's unsettling. It's unsettling that I feel uneasy about discussing vaccines with most of my patients now. And I do at their annual physicals. I go through a list of all the recommended vaccines and check and see what they've had and what they haven't, and tell them what's recommended. I will honestly say I don't usually ask about the COVID vaccine specifically, just because I don't want to hear it. I don't want to hear the conspiracy theories. I don't want to hear the little jokey jokes about all the problems these vaccines are going to cause and whatever. I just don't want to hear it. If people want my opinion, I'll give them my honest opinion, which is that you should get the vaccine. I personally have had everyone, I think, that's been recommended for my age group. I'm planning on continuing to get them annually with my flu shot as long as they're offered. But it's just sad and this might just be me personally being chicken shit, but it's sad that I should feel like I can't make a legitimate medical recommendation to my patients. And, people come in and want to discuss all this stuff. There's no way in hell I'm taking a statin, but what do you think about these 12 supplements that I bought from fucking Alex Jones? Like, it makes no sense to me at all. And it's just a weird time. It's a weird time to be in medicine. It's been weird since the pandemic started. Maybe someday we'll get back to normal or more like normal. And I think probably health insurance plays into some of this as well. If there's any part of the healthcare system that is the enemy of patients, it's not us healthcare workers. It's health insurance companies that essentially dictate what we can and cannot do for our patients. And often I think patients don't really get that we healthcare people are also at the mercy of the health insurance companies, just like they are. The insurance companies are fantastic at I see them as being puppeteers. They're up pulling the strings, and they're really good at making the patients mad at us and making us mad at the patients. And it's all because of insurance, but somehow we look like the bad guys, and the insurance company just, I just picture them sitting back counting the money, laughing while we struggle in the trenches every day to try and get things for patients that they need. So sometimes I think that frustration and that anger over the insurance situation kind of bleeds over into the clinical part of medicine. Because people don't know, patients don't know. We get phone calls every day at the office from people who don't even understand how to fill their prescriptions, how that's supposed to work. You need to call the pharmacy, give them the number on the bottle. Yes, you have 10 refills. You're using an old bottle. Like, we have to explain that daily. So I can definitely understand why people struggle to navigate the very complex system of medical billing and insurance and all that. And honestly, I don't understand it very well myself. I know how to do what I'm supposed to do. But when people ask, well, what's my insurance going to cover? Well, how much is this going to cost? Dude, I have no idea. I don't know. I have no idea. Which insurance should I get? Which should I choose? I don't know. I don't know. It's stupid. The whole thing's stupid and complex, and I wish it was different. And maybe that's not an excuse. Maybe I should put more time into learning about how it all works, but I don't. So anyway, that's my little 10-cent theory on what's going on in healthcare these days. I'm sure policies are changing as we speak. Okay, let's talk about the hepatitis B vaccine. This was first introduced in the United States back in 1981. And initially, it only targeted high-risk groups, so that would be healthcare workers, men who have sex with men, and IV drug users. Doing it that way did not have much of an impact on the overall incidence of Hep B because a lot of infections occur in people who did not have identifiable risk factors. 10 years later, 1991, that's when our friends at ACIP, back when it was legitimate, recommended the universal hepatitis B vaccine for all infants. That also included screening mothers for hepatitis B surface antigen. That also included giving Hep B immune globulin and the vaccine to infants who were born to Hep B positive mothers, and also catch-up vaccines for unvaccinated children and adolescents. Around that time, also OSHA, the Occupational Safety and Health Administration, mandated that employers offer Hep B vaccine to healthcare workers at no cost. 1995, they added routine vaccination of unvaccinated adolescents and everyone up to 18 years of age in 1999. The current recommendation as it still stands is the first dose administered within 24 hours of birth to all medically stable newborns who weigh at least 2 kilograms. 3 years ago, ACIP and CDC recommended universal Hep B vaccination for all adults aged 19 to 59, regardless of risk factors, and for adults aged 60 and older with risk factors or by request. So essentially, they've ramped it up from giving it to only people who were at high risk to now basically everyone. And it seems like it has worked. The vaccine is very effective at causing seroconversion in everyone who gets it, meaning people who get it achieve anti-Hep B antibody levels greater than 10 milli-international units per ml. Over 95% of healthy infants achieve that after a 3-dose series, whether their mothers had Hep B or not, and whether they received Hep B immune globulin or not. Seroconversion rates in children, young adults, also above 95%. Healthy adults under 40, typically 90 to 95% seroconversion rate. The response does decline with age. People over 60, looks like about 60 to 75% achieve that level of seroconversion. It's also lower for preterm and low birth weight infants. So in infants weighing less than 2 kilograms, it's about 68 to 93%. And in those cases, it actually helps to delay the first dose until they're a month old. Of course, you do get some seroconversion if you only get 1 or 2 doses, but obviously you need all 3 doses to have the most robust response. As far as long-term protection, you do see those anti-Hep B antibodies decline. However, it's one of those that remains in the immune memory, so you still get ongoing protection. It looks like about 63% retain measurable immunity after a median of 10 years following childhood vaccination. Detectable immunity declines about 6% per year. But you can also see that people who still mount a quick and robust antibody response to a booster dose is around 90%. So that indicates that the immune system still remembers how to attack Hep B and would recognize it, which is why they don't require booster doses beyond the 3-shot series, unless you're high risk. It is possible to get breakthrough infections, of course. I think that's another thing that frustrates people about vaccines. Like, I can tell you to get all these vaccines. Can I tell you 100% that you're not going to get the flu or pneumonia or COVID or whatever if you get these vaccines? No, I cannot. So breakthrough infections are possible with Hep B, especially in infants born to Hep B positive mothers. The incidence on that, infants who are born to Hep B positive mothers who get both the complete vaccine series and hepatitis B immune globulin, is still 2 to 5%. The risk of a breakthrough infection is highest during the first 2 years of life. And as you would think, the mother having a high viral load, delay in administering the first dose of the vaccine and the immune globulin, and of course being infected with variants of the virus that are not covered by the vaccine, those things all increase the risk of breakthrough infection. In the general population, One study that looked at people over a 22-year period found that only 3.2% of acute Hep B cases happened in people who had received any Hep B vaccination, and only 18% of those people had completed the full vaccine schedule before they were exposed. So the risk of getting hepatitis B if you're born healthy and get your full vaccine series is pretty low. And most of those breakthrough infections in adults are mild or asymptomatic, and the risk of progressing to chronic hepatitis B is very, very low in vaccinated people. And I should say that it also has been effective in reducing the incidence of hepatocellular carcinoma that comes from chronic Hep B infection. So it clearly works. In the United States, before the Hep B vaccine was started, 200 to 300,000 people infected a year, including 20,000 children. As of April 2025, overall cases are down to around 14,000 annually, and we're down to about 250 chronic Hep B infections in kids a year. 252 down from 20,000, and 14,000 down from 300,000. So that's a big change. One of the presentations that was given during the ACIP meeting where they decided to change the recommendation was by Cynthia Nevison, who is a PhD in I don't know what. She doesn't seem to think that the decline in Hep B disease is really all that much due to the vaccine. She's saying that post-transfusion hepatitis B transmission has gone down, and improving dialysis practices so people don't get Hep B from that has affected it, and needle exchange programs have affected it. And she also says the majority of cases come from people not born in the United States. I found a good article from PBS kind of fact checking all of this, so I'll put links to all of this stuff in the show notes if you want to look at it for yourself. But long story short, it seems like all the legitimate medical authorities disagree with this. It seems like we have a lot of data that indicate that the vaccine has worked very well, it's very safe, and there's really no obvious reason to stop doing what we're doing. I was in Chicago when I first heard this news on the actual TV news, and they were saying that the Illinois authorities are not changing their recommendation about Hep B vaccination based on this CDC recommendation, which, of course, the ACIP recommendation does not change the CDC guidance. Whoever's in charge has to sign off on that, but it seems likely that that is going to change officially. It seems like here in Alabama, the state medical authority will probably follow that recommendation and change the recommendation here. That's another thing that is disturbing, that now it depends on what state you live in as to what medical care you're going to get or get recommended or have access to, especially when you look at contraception and abortion, those kind of issues. It depends on what hospital you go to. It depends on what city you're in. It depends on what state you're in. That's absolutely atrocious. Our healthcare system's so screwed up. Okay, so that's what I got on Hep B vaccines. I don't have kids, but if I did have kids, my wholehearted decision would be to go by the established vaccine schedules that have been in place forever and vaccinate those kids. We never want to be arrogant in medicine. We never want to say 100% this is the right answer. We get things wrong. Guidance changes over time. I'm always open to that. If it turns out there is some link between things we think are good and things that are actually bad, of course, we're going to change practice. But in this political environment, it just feels like these decisions are not being made for the right reasons. And I've said multiple times on the podcast, I'm going to start paying more attention to what the medical society guidance is than the federal authorities during all this. And I think that's what everybody should do until this administration is gone, if we ever have another election. It's too much. It's too complicated. We talk about our dream jobs all the time at work. A lot of my colleagues say they would like to go work on an assembly line and just put their earbuds in and listen to music and do the same thing all day and not really have to think about anything. My dream job, I think, is driving a garbage truck. One of my patients does that for a living, and I'm so jealous every time he comes in. I've always asking him all these questions about what he does, and I hope he doesn't feel like I'm trying to patronize him, because I'm not. I truly am like, oh my gosh, that sounds amazing. Just ride around by yourself all day, pick up the trash cans. I'm sure there's BS associated with it, just like any other job, but some days that sounds real nice. We've made it to L in our Alphabet Soup series. Recently, a past guest and friend of the podcast reached out to me with an idea for an L topic that they wanted to cover. So at some point, we'll get an episode out on that. So I'm really excited for you to hear that. In the meantime, I'll probably just skip it and roll on until that is ready to be done. So look for that at some point in the future. Also, some pretty exciting news about another venture I've been working on. I'm not ready to put it out there yet, but hopefully in the next couple of months, I'll have news about another thing that I've been working on that I can share with you that I'm really excited about. So stay tuned for all that. For now, I hope you're well. I hope you have a great week. Go get your shots. Take your kids to get their shots too. I'll talk to you later. All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters. If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order.